Good afternoon, everyone. This is Mayor Robert Garcia. We are doing our community and our media update, which we do every Monday, Wednesday, and Friday at 3 o'clock. Today is May the 20th, 2020. So today, of course, we have with us, as we always do, our ASL interpreter behind us, Paola, and we have Alice from the Health Department, who will do a translation in Spanish at the end. And so thank you to both of them. And then with us today, we also have Kelly Colopy, who has joined us before, and she is the director of the Long Beach Health and Human Services Department. So all of our health team, including Dr. Davis, and all of our lab work and all the workers that are part of the health department all work with Kelly and under her leadership. And so we're happy to have her today to have some updates for us as well. So I'm going to give some broad data and then get into some topics of interest, and then turn this over to Kelly, who's going to go over some of the recent data and some other updates for us today. Well, I want to start by saying that we have over 1,400 residents total who have tested positive for COVID-19 in Long Beach. 919 approximately have recovered. And then as it relates to deaths, we have a total of 65 deaths in Long Beach. There were 3 additional deaths today. And actually, just yesterday early evening, the city also announced 10 additional deaths that were not from just yesterday, but were a delay in reporting from one of our hospital partners. And so they were over multiple days. And actually, Kelly is going to kind of explain and walk us through what days and how that happened, because that's not something that certainly any of us like to see. But that's why she's also here as well. But the total number is 65. And 50 of those are from long-term care facilities. And I think that the deaths that we had yesterday, and even though they were over a period, I think, of 4 or 5 days, it's just, I think for us, it's a sobering reminder that this is still a health crisis. People are still dying every single day. We still have many individuals in our hospitals. I think that number obviously is going up and down in the last week or so. And each one of those individuals matters and mattered, and their families are grieving. And we have to take this very seriously. And so it's easy to get caught up in talking about reopening and in the economy moving forward, which is, I know, so important for workers and for the city. But as we do that, we can't just get caught up in driving this reopening without thinking about the human consequence of what these families are going through. And each of those 65 individuals that have died, they are our neighbors. They're part of our city. And each of them deserves our love, respect, our prayers. And so as we talk in the next days ahead and get closer to being closer to 2 weeks since we began relaxing our orders, let's just keep them in our thoughts. A couple things to report. The first one is I wanted to just give and announce a new program as it relates to helping renters and tenants in the city of Long Beach. The City Council has been discussing this issue and has brought forward this issue as well. But we want to be able to today announce that the city is moving forward on a new program directly for renters, and that is establishing an emergency rental assistance program that would provide up to 3 months of rental assistance for residents that qualify, that are low income or that are struggling because of COVID to pay their rent. We are having a conversation about the amount of money. It could be up to $1,000 that someone receives for 3 months, and so it's $1,000 over each month, and that would certainly help a variety of folks across the city. We've talked about maybe that number should be lower if we want to help even more people. So it really depends on what system the council ends up voting, and so they will debate that topic. But we want to report that we are going to launch this emergency rental assistance program, and it could provide $1,000 each month, up to 3 months, for rental assistance. This program will be in front of the City Council in the first meeting in June, and the program is really possible utilizing both state and federal funding opportunities that the city already has in some other funding mechanisms. And so for us, we know that the virus has really hit families hard. It's hit tenants and small property owners hard as well. And this is a program that's going to help both the tenant, because we know that some folks are not working, they're unemployed, maybe they haven't received that unemployment check or are really struggling. It's going to help them. But it's also going to help those small mom and pop property owners that have maybe a couple units that they also need to pay mortgage on their property and maybe don't have rent coming in. And so this direct rental assistance will allow and connect the renter with their property owner and provide that resource so that it's paid by the renter but goes directly to the property owner for rental assistance only. So the program is for rental assistance, and we think it's good for both parties, and we're excited about that. We want to thank our state and federal partners for supporting this program, and we want to expand that program in the weeks ahead. And so we're happy to report that. In addition, as it relates to supporting tenants and renters, there's been a lot of questions about the eviction moratorium that's currently in place. Last night, the City Council voted to extend the eviction moratorium for a longer period of time, and so it would be for an additional 60 days. And so that is until essentially July 31st, or essentially up until to August, where folks will be able to have that eviction moratorium in place. There's also some discussion by the council to extend the amount of time that renters can pay back rent. The details of that are still being debated and will be in the next couple of weeks. But overall, the good thing is that we feel very, very positive that renters are now getting additional assistance, and we're trying to help, of course, property owners as well. And so there's a lot in the works there, which we understand for some small mom and pop property owners. It's a very hard situation. Want to give a couple other updates. Open streets, and so we know that last night the City Council also adopted a new open streets program. This is something that we proposed to reopen streets across the city. And I want to thank the Long Beach City Council for their really incredible work in reopening all the streets. We know that what this is going to mean is that we're going to look at corridors like 2nd Street, like Bixby Knolls, 4th Street Retro Row, Naples, parts of North Long Beach, and look and ask restaurant owners, do they want to open up and expand their sidewalk? Or do they want to, can we close down some of the street to allow restaurant dining to expand so that we can really create a more active space, allow distancing to happen within our restaurants, but also create recreational opportunities in neighborhoods across the city so that folks can go out as we close streets. We think that some streets could begin closures in the next couple of weeks, and so that's something that's exciting for the city. And I want to thank the Long Beach Council for adopting that Open Streets initiative. Businesses are already lining up to be involved. And we're excited to create safe spaces for families, neighborhoods, and for some of our small restaurants that are also struggling to be able to reopen up safely once they're allowed to reopen up by the state. So we know that they have not yet been allowed to open up by the state. Want to also provide an update on street sweeping enforcement. We know that enforcement has started again. Street sweeping is a public safety issue. But we know that it's going to be difficult for everyone to have been alerted or to ease into now that we're having street sweeping. So we just want to let everyone know that over the next 2 weeks, as we've transitioning to this next phase, if you received a citation and you can't pay, or you didn't get the notice, or you have a financial hardship, we're going to waive that ticket and we're going to waive that citation for you because we know a lot of people are still struggling. On the ticket, on the back, there is a parking citation website and information of how you can get that waived. Just call in, email, and essentially it'll be an automatic waiver for you because we know that while we have to get back to getting people to move cars because a lot of our streets, we picked up 2.5 tons of trash on Monday. We know that people still need relief. And so if you do get a street sweeping citation, we want to help still over these next 2 weeks, but we still need folks to move their cars. So please get out there and continue to move those cars as much as possible. We know that at the end of this week, we hope to go over some data with everyone on Friday. That's our goal, is to go over a lot of data that we've looked at for the last couple of weeks as it relates to how we're doing with hospitalization rate and a bunch of other metrics. The one person that's watching that actively and has all the data in her head all the time is our Health Director, Kelly Colopy. And so I'm going to turn this over to her to kind of go over first and foremost the increase we had in fatalities and then some other facts as far as what we're doing as well. And then she's prepared to also answer any questions as it relates to those if we need to as well. So Kelly, please. Thank you.
Thank you, Mayor. Good afternoon, everybody. As the Mayor discussed, we had 65 deaths within our city, which includes 13 new fatalities reported since Monday. All of these fatalities have underlying health conditions, and most are older adults. The new data does not suggest a spike or surge in the fatalities for the City of Long Beach, but a delay in reporting. Delays in reporting are common across the state and Los Angeles County, as this pandemic is testing existing reporting protocols in unprecedented ways. The fatality data reporting can be delayed for multiple reasons, including when a Long Beach resident passes in a hospital outside of Long Beach, when a person passes in their home and the reporting goes through the coroner's office. There may be staffing capacity issues at different facilities for reporting, or when someone passes away and the COVID-19 testing results come after the death. The data that were reported on Tuesday reflected fatalities from May 13th through May 18th. The reported deaths were received by the Health Department and finalized late on Monday. The table that's being shown now shows the actual dates that these deaths occurred. So you can see between May 13th through May 18th, on the 13th we had one new death reported. On the 15th we had 3, the 16th 1. The 17th we had 3, and on the 18th we had 2 new reported deaths. So we are working very closely as the Health Department to work closely with hospitals, our healthcare facilities, and our long-term care facilities to support the reporting of the timely results. But I do want to share a little bit with you about how we get our information. So the state requires that hospitals and healthcare facilities report deaths directly to the Long Beach Health Department within 24 hours. If a death occurs at home, the county coroner will report the death to our city health department. If a Long Beach resident dies outside of the Long Beach health jurisdiction, so outside of our city, the county where that person died, the county jurisdiction where the death occurred, will report that death to us. So, for example, if we have someone who lives in Long Beach who dies in a hospital in LA County, those deaths will be reported to the LA County Department of Public Health, who will then notify us. This process may take several days by the time that we receive the information. The same principle applies for coroner investigated deaths. Because we have a close working relationship with long-term care facilities, they often notify us by phone, and we remind them to make sure that they submit the form within the 24-hour time frame. All of these factors can lead to delays in the mortality numbers sent to the city, and in turn, the city's ability to report to the community. Given this, it would not be unusual to see sudden increases in fatalities, again, in the future, attributed to the reporting protocols. When we report the data to you each day, we're reporting the numbers that we have at that time. However, when we're looking at our trend lines, when we're looking at our whether we're determining about policy and our decisions, we align those data to the specific dates for which the deaths occur, and then we look at those trend lines. And you'll see those in the graphics that we have online on the COVID-19 webpage. The city will continue to work with all of our partners to ensure we're meeting the state-mandated reporting requirements, and I'm happy to answer any questions about the data or any of the process. Thank you.
Great, thank you, Kelly. And why don't we turn over to Jake to take questions?
Thank you very much, Mr. Mayor. The first question will be coming from Rachel Jordan from ABC 7. Go ahead, Rachel.
Hey, so my questions are about those fatalities. So were all of the fatalities that happened over the weekend that were delayed in reporting from Long Beach Memorial Medical Center? And can you talk a little bit more about these mandated reporting requirements? I know you went over them, but are these requirements being met, and what happens when they aren't met?
Yeah, so the reporting requirements are set by the state, and the state holds the facilities accountable for those reporting requirements. We work very closely with our partners to encourage them to do that reporting, but in the end, it's the state that holds that. In general, we are getting very good data from our facilities. Sometimes it's delayed by a day or so, but generally not delayed by much. And then, as I described earlier, there are many ways for which the data are collected, the different ways that we get it. And so we will get data at different time frames depending on where the person died and what the situation was. In terms of the folks for the delayed reporting, they were not all from Memorial. We had one case where a person was tested and passed away, but then we didn't have the results. And so that was the delay in attaching it to a COVID-19 case. And then in other cases, they showed up on Monday and those were included in the 10, but those were accurate reporting times.
All right, the next question will be from Valerie from the Long Beach Post. Go ahead, Valerie.
Hey, so this question is for Kelly Colopy. LA County today announced the R value countywide has been fallen below 1. I hadn't heard of R value until then. Does Long Beach calculate our own R value? And if so, what is the value? And then if not, do we just use the counties?
No, Long Beach calculates its own. That's the transmission rate. As of 2 weeks ago, and I don't have the most updated rate, but as of 2 weeks ago, our transmission rate was at approximately 0.35. So we were far below the 1, and our numbers were declining. We're going to be going back, and you'll be hearing more about that on Friday as part of the mayor's data conversation at the Friday Facebook Live.
Thank you, Kelly. All right, Haley from the Press Telegram. Go ahead, Haley.
Hi, yeah, my question is about these delays in reporting. It seems like there may have been more of them in the past week or so, and I just wanted to know how the city thinks about these delays and backlogs when it is planning for potential reopening, and how that data may impact how the city looks at plans moving forward.
Yeah, so we continue to work very closely with people. I think what happened in this case is that the delays all occurred over one specific time frame, whereas because coroner investigated case results or people who are passing away in hospitals, not in Long Beach and others, the 24-hour reporting time frame is those who are directly within the city of Long Beach being able to access those data. But we do know that there is a delay. So when we're paying attention to our data and our trends, we do sort of we look at the immediate data, but we also look back. We look at sort of the lagging indicators to understand, once we know that those data are accurate, everything is reported, to be able to understand what the trends look like. So we're spending a lot of time looking at both of those numbers along the way, but we do work very closely with our partners, and they've been good partners with us moving forward.
Great, thank you very much, Kelly. Next question is from Jason from the Long Beach Post. Go ahead, Jason.
Hi, this question is actually for the mayor regarding his announcement about the rental assistance program. Could the city, I know that it hasn't been voted on, but in the future, if the economic situation doesn't improve, could the city look to find more federal or state dollars to possibly extend this program farther out than the 3 months that's proposed? And what's the income level that qualifies for this?
Absolutely. And so the answer to that is yes. I think that we right now are, there's a couple of sources of funding. The program that we're announcing today, we have the funds for, and that's a combination of federal and state resources that we already have access to. But beyond that, we are really counting on, especially the recent announcement by Governor Newsom to set aside money directly for cities. That's going to be an incredible future source of funding. And beyond that, we have asked the county, even with this program, the county also has a similar program. We've reached out to the county as well to see if they will supplement our program and partner to increase both either the amount of folks that would be eligible or the number of what that number should be, or how many months it could go out to. What we want to ask the council to kind of debate is really how many folks will we serve and what the numbers should be. So staff's recommendation is the $1,000 for 3 months, but at the end of the day, we're going to look for input from the council as well. And I think I have it right here. I mean, what they're looking at right now is it'll be for households earning up to 80% of the area median income that have experienced income loss due to COVID-19 impacts is the current metric. I think that's right, Jake. I think that's what you have in your notes as well. Correct me if I'm wrong. But I think that as this press event was going on, I think the city has probably posted a memo that also went out to the city council, which has the whole report on this program. And so I think it's probably up at the city manager memo site. And if it's not up right now, it'll be certainly up in the next hour or two. And so, yes, if we get federal funding, state funding, county funding, all of those will help this program and the amount of people that we can serve. And again, this program helps tenants and the mom and pop property owners.
All right, great. Thank you, Mayor. All right, we're going to go over to our Facebook Live questions. We've got a few questions that are coming in from the community, and I think this is going to be some good conversation here. Mayor, one of the questions was regarding daycares. Can you give an overview of what we're doing for daycares and any potential protocols for daycares, and maybe have Kelly assist with that?
Yeah, I mean, Kelly's probably better equipped to respond to the protocols at kind of daycares and how we're moving forward.
Yeah, so as of the last couple of weeks, the governor, originally daycare was considered an essential service for those who are essential workers. It has shifted at the state level that daycares can now, they're essential service for all people going back to work. And so we are working closely with our local providers to provide guidance. There's CDC guidance and other protocols, and we'll be working very closely with our providers to be able to open safely, to be able to work closely with the families. And a key goal for us that we know as the city is that, you know, people can't get back to work if their kids are home by themselves. And so we are working with our different facilities as well as our Parks and Rec department and others to determine how we can start to serve and engage with people to be able to ensure that their kids have a safe place to go.
Great. Thank you very much, Kelly. As we're talking to you right now, Kelly, will you elaborate a little bit on morbidity factors? And there's some questions on here about pre-existing conditions. We've talked a little bit about pre-existing conditions on our media updates and our different updates to the community. The question along this lines is, how many of these fatalities are a result of purely related COVID-19, other than just the continued additional underlying health conditions existed or applied? A lot of people are just trying to dispel some of the fear out there about the fatalness of COVID-19.
Yeah, so all of the fatalities in the city of Long Beach have been related to an underlying health condition. So what we know is that COVID-19, which is one of the many reasons why we've been, why we implemented Safer at Home, is for people who are older adults and people who with underlying health conditions for which COVID has greater impact and can cause far more serious illness. And that is what has happened for our deaths within the city of Long Beach. In addition, we're seeing that most of our deaths, I think we've had one death, in an age of 40, but most are over the age of 70. So those are the key factors of it. And the underlying, underlying health conditions can be anywhere from lung disease, heart disease, diabetes. They might have cancer or just compromised immune systems. There are a lot of different factors that make it so that COVID makes you more ill than they would otherwise in the community.
And I think it's important to know. I think I see this debate online sometimes as well. And folks that are dying from COVID and have underlying health conditions are still dying from COVID.
Yeah.
And I think that you can read it whichever way you want, but at the end of the day, these folks are testing positive for COVID, and COVID is essentially damaging their ability to fight off other disease or to be able to breathe the way they normally would, or is denying them the ability to recover from another illness. And so COVID is affecting every single one of these deaths and has produced the fatality rate that we have today. And so I don't think it's appropriate personally to minimize the strength of this virus. This is a serious virus. There's no vaccine. We're all hoping and praying that we will have one at some point in the future. And there's this whole, kind of minimization of COVID that I hear a lot and I from folks, and I think that's dangerous. It's a mistake. And 65 people that have died in our city is serious. It's a big deal, and people should take it very seriously. And the issue, of course, is that yes, a lot of the folks most of the folks that have died are seniors and are in our long-term care facilities. But the people that are giving them disease are us, are younger people, are people that don't have symptoms, are folks that are catching it and being irresponsible and then giving it to an older person or passing it on. And so this is happening across the country. And so I think that we should all be tired of kind of folks thinking that they have superpowers to not get the virus, because if you do get it, you are also likely and possible to pass it on to someone that could cause them great harm or death. And so I think that we should all continue to take COVID-19 as a serious virus with no vaccine.
Thank you very much, Mr. Mayor. Mr. Mayor, will the city rethink its density plans in the wake of COVID-19? How do you look at the future of the city moving forward relative to that?
Well, I think first, there's conflicting reports about the impact of density on disease and COVID, and this in particular. I think that obviously what it is going to make us rethink is the way we build out places to live and spaces where we congregate. So I think this disease is teaching us a lot about that. And so I think that you will see changes in the way businesses are developed and the way we interact with businesses and the way homes are set up. But I don't see COVID having an impact on the way cities develop in the future. At the end of this disease, we're still going to be in a housing crisis. At the end of this disease, we're still going to have homelessness that is going to be a huge issue for us, and maybe even bigger issue for us. People are still going to need homes and places to live, and the country continues to move towards cities, and so. I think it will alter our discussion and the way we talk about the way we build cities, and it will change the way we build cities. But we will continue to develop as a country, and I think that's going to be important as we continue to have a homelessness crisis.
Mr. Mayor, we know you're doing a lot of outreach to some of those small retails and the restaurants and even the nail salons and hair salons and barbers. Do you think there's a potential opportunity here in the near future where there may be the opportunity for them to open up by appointment only to potentially minimize risk for those that are providing some of those personal services? Yeah,
I think actually, as a reminder, we're in stage 2. Stage 2 is we still have restaurants and some offices, at least in the case of Long Beach, to go before we move on to stage 3. The governor has not announced even the second half of stage 2 yet, and so we're still working to get to the restaurant piece. And once that piece and the dining rooms are more available, only then is stage 3 opening, which of course, per the state, includes grooming and personal hygiene and those other and barbershops. But we are planning and preparing. And I hear from nail salon owners and barbers and salon owners all the time. So we're planning a lot because we want to be able to do it safely, most importantly. In fact, I think this Thursday or Friday? Thursday? So I think this Thursday, I think I'm hosting a call with any kind of a grooming small business owner or worker that wants to join us for a citywide call to kind of give information on how we're doing and what our timelines look like. If you're interested in that, you can email our office at mayor@longbeach.gov and we'll give you the call-in information. But all of the business improvement districts across the city have reached out to the businesses or some of the businesses that are grooming businesses to jump on this call on Thursday. So we'll have a lot of information on Thursday on how we're thinking about reopening up these critical services. And trust me, I'm grateful that my husband cuts my hair, but there's probably nothing I want more than a haircut from my former stylist. She's a wonderful lady that downtown has been cutting my hair for 14 years, actually, at Fantastic Sam's in downtown Long Beach. And she's great, and I'd love to see her again as soon as this is over.
Great, thank you, Mayor. Another question here we have is, Mayor, do you see Long Beach youth sports specifically being able to start before July 4th? There's a concern here about letting the leagues know and the parents know, and obviously, especially even with the parks programs that we've had that are really successful in our city, to know if the season's canceled or if they should continue to move in that direction.
I've encouraged the team to try to make a decision on this quickly. I think that our health department should give people notice. I personally, this is not based on any conversations I've had with the health department because they're going to make the decision. I'm not optimistic that we're going to have youth sports and summer programs and in the way we've had them in the past. I think there likely will be large modifications to the way that they're done, or full-on just major cancellations of the programs this summer. But I think that the health department team is working on what that could look like, what modifications could look like, and I'm hopeful that that next week or soon we'd be able to kind of let the public know what the plan is at least. But I'm not optimistic that we're going to have a robust youth sports program or parks and recreation program over the summer.
Mayor, this rental assistance is really important. A lot of people are asking about this program, and we see a lot of great comments on Facebook. One question is are immigrants going to qualify for rental assistance?
If by immigrants you mean undocumented immigrants, because some immigrants. Personally, I think they should. I don't know. I think they likely will. I'm asking folks. I don't know all the details yet. I don't know if we know. Here's the way I look at it. We need to help everyone in our community right now, and whether someone is documented or undocumented, to me personally, is irrelevant. All people deserve our support. They deserve our compassion. They deserve our kindness. And if someone is struggling, I could really care less if they were born in the United States or if they were brought here as a child. I don't think that should matter. That's my personal opinion. And so a rental assistance should go to everyone. And while I don't know the details of the coverage yet because we just developed the program, I certainly will support it going to anyone that needs assistance. And once we develop that program, we'll be able to put out more information on it.
Thank you, Mary. And absolutely. And we do want to make sure all the viewers out there that are watching us understand that the update to the emergency rental assistance is online. If you want, please visit us at www.longbeach.gov/COVID-19, and you'll be able to get additional information. And per the mayor's comments a little earlier, we do want to stress to you that the city did have that proposal establishing that emergency rental assistance program that would provide up to $1,000 per month for up to 3 months for rental assistance, and it would be for the households earning up to 80% of the area median income that have experienced the impact loss of due to COVID-19. So, Mayor, you were absolutely correct on those statistics.
And let me add that, and all of that, of course, is the proposal that staff is kind of bringing forward to the council. And so I expect that and encourage that the City Council will debate this issue on June the 2nd or approve the program. I believe June the 2nd is the date, the next meeting. And so I'm going to certainly weigh in with them and kind of give my thoughts, but I would encourage the public to as well. I think it's an opportunity to engage with your council members. Let them, they should hear from you on what you think, how the program should work, because we want to help people, and at the end of the day, that's what matters the most. So thank you, Jake. And with that, why don't we go ahead and turn to our Spanish translation.
Gracias. Muchas gracias, alcalde García, y gracias a la directora Kelly Colopy, que nos acompaña hoy esta tarde. Es la directora del Departamento de Salud de Long Beach. Empezamos con nuestros últimos números. Hasta hoy tenemos 1,400 residentes que dieron positivo con el coronavirus. Cerca de 919 personas se han recuperado y hemos perdido a 13 residentes de Long Beach. Queremos aclarar que no ha sido sobre los pasados 2 días, pero ese número sí eleva a las muertes del coronavirus en Long Beach a 65. 50 de esas muertes han sido relacionadas con los centros de enfermería y atención en la ciudad de Long Beach. Y por este momento, para tocar un poco de los datos sobre las muertes que vimos, la elevación en las muertes, ha sido que las condiciones, todas las personas que se murieron del coronavirus, de los últimos que reportamos, de los 13, tenían condiciones de salud subsiguientes, subyacentes. Los nuevos datos no sugieren un aumento ni un aumento en las muertes de la ciudad de Long Beach, pero más bien las muertes reportadas ayer, el martes, informan del fin de semana que tenían un poquito de retraso y vinieron del hospital de Long Beach Memorial. Una fatalidad de la que determinación de las causas relacionadas con coronavirus se produjo después de la muerte del individuo y por lo tanto se informó un poco más tarde. Y las muertes reportadas desde el 18 de mayo. El Departamento de Salud recibió estas muertes retrasadas y finalizó el lunes por la noche. Estas muertes ocurrieron entre el 13 y el 18 de mayo de este año, reflejando, hubo una imagen que pusieron en la pantalla hace momentos y esas muertes ocurrieron entre el día 13 de mayo hasta el 18 de mayo. El 13 de mayo tuvimos una reportación de muerte, el 15 hubieron 3 muertes, el 16 de mayo una, el 17 3 muertes y el 18 2 muertes. El hospital está trabajando estrechamente con colaboración con el Departamento de Salud de Long Beach y todas las instalaciones médicas para garantizar la notificación oportuna de los resultados. Un poquito del protocolo que usamos para recolectar los datos. Son los retrasos en la presentación de informes son comunes y en todo el estado y en el condado de Los Ángeles. El estado requiere que los hospitales y las instalaciones de atención médica informen las muertes directamente al Departamento de Salud de Long Beach entre 24 horas. Si ocurre una muerte en el hogar, el equipo forense del condado informará la muerte a los oficiales de salud. Si un residente de Long Beach muere fuera de la ciudad de Long Beach, la jurisdicción del condado donde ocurrió la muerte tendrá que informar a los oficiales de salud de Long Beach. Por ejemplo, si un residente de Long Beach muere en un hospital de la ciudad de Los Ángeles, la muerte se informa al Departamento de Salud Pública del condado de Los Ángeles y luego ese Departamento de Los Ángeles luego enviará un informe de difunción por correo electrónico al Departamento de Salud de Long Beach. Sabemos que es un proceso un poco delicado, pero solo para que entiendan un poco más. Este proceso lleva varios días para cuando los oficiales de Long Beach reciban la información. El mismo proceso se aplica a las muertes investigadas por el equipo de forense también. Debido a que tenemos relaciones de trabajo cercanas con los centros de atención de enfermería a largo plazo, a menudo nos notifican por teléfono y les recordamos que envíen el formulario de informe de muerte dentro del plazo, que son las 24 horas. Todos estos factores causaron retrasos en los números de mortalidad enviados a la ciudad y a su vez la capacidad de la ciudad para informar a la comunidad, como lo estamos haciendo hoy. La ciudad depende de la información enviada desde otras jurisdicciones, centros de salud, hospitales y otros socios médicos. No sería inusual ver aumentos repentinos de muertes en el futuro atribuidos a este protocolo de informes. La ciudad continuará trabajando con todos sus socios para garantizar que cumplan los requisitos de informes obligatorios del Estado, que tienen que seguir el Estado, el condado de Los Ángeles y luego la ciudad de Long Beach también. Ahora, por un momento, queremos dar unos pocos más datos que nos compartió el alcalde García. Sabemos que en estos tiempos tocamos un poco este tema el lunes sobre los inquilinos y los problemas con los pagos de renta. Y sabemos que estos tiempos han sido muy difíciles para muchos inquilinos en Long Beach y estamos trabajando en 2 programas para ayudar. Primero, la ciudad extenderá la moratoria de desalojo actual y el pedido de aplazamiento de alquiler por 60 días hasta finales de julio. Los inquilinos tendrán hasta el 31 de julio del 2021 para pagar su renta diferida. También queremos compartir que en cuanto a los propietarios, estamos buscando establecer un fondo de préstamo rotativa para los propietarios que han sido afectados por el coronavirus. También estamos investigando el alivio de la ejecución hipotecaria. Mientras tanto, estamos monitoreando la legislación estatal y federal que afectará a los inquilinos y propietarios en las próximas semanas y meses. También estamos trabajando en una forma de ayudar directamente a los inquilinos que han sido afectados por el coronavirus. La ciudad propuesta establecer un programa de asistencia de alquiler de emergencia que proporciona hasta $1,000 por mes durante un máximo de 3 meses para asistencia de alquiler. Estos programas todavía están está en discusión con la alcaldía y vamos a tener más reportes sobre esto en los próximos días y también en las próximas juntas de la alcaldía de la ciudad de Long Beach. Una iniciativa de calle abierta. Sabemos también que la reunión de la alcaldía ayer avanzamos con una iniciativa de calles abiertas que ayudará a las empresas y los residentes. La iniciativa de calles abiertas permitirá cambiar temporalmente el propósito de algunos de nuestros espacios públicos, como por ejemplo restaurantes que puedan vender comidas al aire libre. Podemos ver también en otras partes del mundo y el país que están poniendo sus ideas muy creativamente para todavía poder juntarse en público, pero es muy importante seguir todo eso primeramente saludablemente. Estos proyectos estimulan la actividad económica y apoyan la construcción de la comunidad y ayudan a darnos la sensación de normalidad que todos anhelamos estos días. Open streets, como se dice en inglés, o a calles abiertas, será un importante paso adelante para mantener competitiva a la economía única de Long Beach durante esta crisis de salud. Pero no sabemos todavía exactamente qué fechas y le tendremos más información también en el futuro. Algunas de las actualizaciones del barrido de calles. Como saben que el barrido de calles se reanudó el lunes, sabemos lo importante que es este servicio público para mantener limpias nuestras calles, aceras y nuestras playas limpias. Es importante que se hiciera con el entendimiento de que muchas personas están financieramente en este momento y no pueden pagar una multa de estacionamiento. Es por eso que anoche en la reunión de la alcaldía fue crear un programa de extensión de dificultades del coronavirus para los residentes de Long Beach. Este programa solo se aplica a las fianzas de barrido de calles, no se aplica a otras leyes de aplicación de estacionamiento, tal como las calles y curvas que están pintadas rojas o azules. Esas fianzas todavía, si agarró una, la tiene que pagar. Durante las próximas 2 semanas, para aquellos que aún están aprendiendo sobre nuestro programa de barrido de calles, se puede remover la primer fianza a través de un proceso de la ciudad para aquellos que han sido afectados negativamente por esta pandemia. Si necesita instrucciones o quiere saber cómo puede impugnar esa fianza, puede visitar la página de web longbeach.gov/parking/citation. Y continuamos agregando estacionamiento también gratuito. Como les hemos dicho anteriormente, hay más de 4,000 espacios de estacionamientos gratuitos. Nomás tienen que visitar también la página de web o llamar para poder agarrar un permiso para estacionar su carro y no tenga que preocuparse por moverlo o por pagar una fianza. Eso es todo por hoy. Muchas gracias por acompañarnos esta tarde. Que tengan buen día.
Y muchas gracias también por mirar este update y te vemos el viernes. And again, we'll see everyone on Friday. Thanks for watching the update. We'll see you at 3 o'clock.